Okay, today we're going to be doing the intramuscular injection, the Z-Jack reconstituting medication, and we're going to administer the medication with the 6 rights. The 6 rights are the right dose, right time, right person, right medication, right route, and right documentation. So the first thing I'm going to do is I'm going to check my vials, checking the expiration date, there's no cracks. If it's multi-use, I'm going to make sure that it's properly labeled. And then I'm going to clean off both vials. I would wash my hands before mixing the medication. So I've got a bottle of diluent and a bottle of powdered medication that we're going to be reconstituting. I'm going to clean both of them with an alcohol pad. Okay. I am going to get my syringe and I'm going to attach a needle. And what I'm going to do is I'm going to pull up air from the medication vial. I would be, before I pulled up air, I would check the amount of diluent that I'm going to be adding and pull up air equal to that. So the amount of diluent we're going to be adding is going to be at 7.1. Okay. And I'm going to add this air into the diluent bottle. And then I'm going to invert. And I'm going to pull up the amount of medication, or the amount of diluent that I'll be adding to the medication, which we discussed will be 7.1 ml. Okay. And then I'm going to clean the medication vial again and inject the diluent. All right. I'm going to safely recap my needle using the one-handed technique. And what I'm going to do is I'm going to gently mix this medication by rolling it in between my hands. And making sure that the medication is thoroughly mixed. Okay, checking against the MAR and the doctor's orders, we would double check our dose, and I'm going to get the syringe that we will be using. And to attach the needle. Okay. And now I'm going to pull up the correct dosage of reconstituted medication. And recap the needle using a one-handed technique. And then we'll go to the patient. Okay, so at the patient's bedside, I'm going to identify the patient using two identifiers, usually the name and the birth date. And I am going to explain the procedure and the medication. I'm going to do the final medication check at the bedside, checking for right person, right dose, and any allergies. I'm going to properly position the patient. For this site, we're going to be using the vastus lateralis, so I position the patient either supine or sitting. And I'm going to wash my hands and put on procedure gloves. I'm going to locate the site that I'm going to use. And I would clean the site with an alcohol pad. And I can use the corner of the alcohol pad to mark my site. So what I'm going to do is, with my non-dominant hand, I'm going to pull the skin taut and away, and I'm going to inject the needle at a 90-degree angle. So using the fingers of my non-dominant hand, I'm going to aspirate for 5 seconds, pulling up and checking to see if there is any return blood. After 5 seconds, if there is no return, I'm going to go ahead and inject the medication slowly for over about 5 to 10 seconds. Okay. I'm going to release the skin, and without capping the needle, I'm going to put it into a sharps container, and then I would gently blot the site with a gauze pad if necessary. And then I would document the medication dose and time in the MAR and the nurse's notes.